Brandis, and welcome to Q&A Wednesday, where you get to ask your health and wellness questions, and I get to answer them. This week, we are following up on last week's Q&A Wednesday when we started the conversation talking about foam rolling and foam rollers. So, if you have not yet watched that video, pause this one, go back and watch it, and then grab your foam roller and come join us. Last week we talked a little bit about what foam rolling is, how it can benefit us, different types of foam rollers, and just a little bit about how you would foam roller. This week I'm going to show you some different ways to use the foam roller. So grab your foam roller and join me on the mat. So we are going to start with talking about how to use the foam roller for our legs. A lot of times I work with people who have a lot of tightness in the back of their legs and their calf muscles or their hamstrings, and so foam rolling can help to really loosen those muscles up. What you will do is come to a seated position, and from here you can put both legs over the foam roller. Now you can either foam roll both legs at the same time or you can do one leg at a time. It all depends on your comfort level and what feels the best for you. You will be using your arms a lot when you're foam rolling, so it's a bit of a workout in addition to helping stretch and loosen up your muscles and your fascia throughout your body. When you are using the foam roller, what you'll do, so if I'm gonna roll out my calf muscles, I'm gonna put my ankles on the foam roller, and if I'm going to roll both legs at the same time, I'm gonna push through my arms, I'm gonna lift up my bum, and I'm gonna roll back and forth like this. Nice and slow and controlled. Okay? If you find an area that's tight, you can hold on that area. You can roll back and forth until it loosens up, and then you can just kind of proceed. Now, if doing both legs like that is challenging, you could just put one leg on the floor, lift your bum, push through this leg, and then roll back and forth like that. And that's a little bit easier on your upper body. You can also just sit and roll your knee here. Doing different positions and techniques will put different amounts of pressure on the foam roller. So if you want the foam roller to go deeper, you have to put more weight and pressure through your leg. If you don't want it to go as deep, then you would put more pressure and support through your other supporting leg as you rolled out one leg at a time. And then what you'll do is you just slowly kind of move the foam roller and roll up the leg. Now, if I wanted to get into my hamstrings, I would just take the foam roller, move it up, and I would do the exact same thing. So a lot of times I'll use one leg on the ground and then my arms, and I'm gonna pull in my abs to stabilize my back to roll out my hamstrings. So just like that, okay? And then you can continue to roll up the leg until you get to the glutes. So a lot of times if you have, people will have tightness in their glutes or their piriformis muscle, which is basically kind of that butt muscle that we like to stretch and roll out. What you can do is then sit on the foam roller, and you're gonna keep weight through your feet and through your arms, and you can just roll back and forth like this. If you want to get a little deeper into those glutes, you can cross one leg over and you can kind of lean to the side, preferably to the side of the leg that is bent, just like that. And then you can switch, shift your weight, go over, just like that. Now I want you to keep in mind that there are many different ways to foam roll out your lower body, and I can't cover them all right now. So if you have a way that works for you, or if you've seen another option or angle or position, I encourage you to do that. I just want to give you some ideas. If you have a foam roller and you're like, I don't really know what to do with it, this is a good place to start. Now, if you have tightness in your outer leg, that pesky IT band that so many people talk about having tightness in, You can lay on your side to roll that out, and then you can roll up towards your hip where the tensor fascia lata muscle is. That's a muscle that's kind of within the IT band. So to get to that, we're just going to sit on the foam roller. I'm going to cross my front leg in front of my back leg, and then I'm going to use my arm and this supporting leg to roll out that IT band. And then of course you kind of have to move as you go through to get different areas. This one is nice because if you want to get more into the thigh muscles, you can just roll an angle. If you want to get more into the outer hamstring muscle in the back, you can angle back and do it that way. Lots of different positions. And then from here, you can just roll right onto your stomach and roll out your quads if you have tightness in your hips, or your hip flexors and your quadricep muscles in the front of your thigh. And then you just keep going and roll them out, just like that. Now there are certain areas of your body that I don't recommend rolling. Those include the tops of your knees or your joints, basically. So you wouldn't foam roll the tops of your knees, the back of your knees, up into the armpit or the axilla, up into the groin area. Some people will foam roll over the hips because there's a little more tissue there, but for others, it can be really, really uncomfortable and painful. And in that case, I would suggest not foam rolling your hip, but foam rolling around your hip. Sometimes if an area is really tight or painful, if we roll around it, it will loosen the tissues up. So then once we go back to that sore area, it's much more comfortable to foam roll that out. I don't ever recommend anyone foam roll the low back because a lot of times it can put way too much pressure on the back and actually cause or aggravate back pain. However, you can foam roll the mid back. So if you have a lot of tightness in this area here, a great way to foam roll it is to lower yourself down onto the foam roller with your forearms. Find a comfortable position. I always encourage people to support their head so that you're not straining your neck. Push through the feet, lift up your bum, and then you just use your legs to foam roll out that mid-back area, keeping your head supported and just within a really comfortable range. I do not encourage you to go down into the low back by any means. So you're gonna stay up closer to the shoulder blade area, and then you can keep rolling all the way up to the tops of the shoulders. At that point, you would stop. I don't recommend foam rolling your neck. I would never teach that. I would avoid that area because that is a very sensitive and delicate area, just like your low back is. Okay, so moving up to our upper body. We can foam roll out the sides. If our sides of our body feel really tight or the backs of our arms, we can always foam roll those areas, but you want to avoid foam rolling in this area. The reason we want to avoid foam rolling in this area here under the arm or the backs of the knees, the groin, is because those areas are very vascular and they have a lot of nerves and we don't want to compress them. The goal with foam rolling is to roll out the muscles and the fascia, not the nerves and the blood vessels. So we want to stay clear of those. The other reason to avoid the joints, such as your knee joints, your ankle, your elbow joint, is because they're really bony prominences in our body. And so foam rolling them, number one, won't be helpful because it's not soft tissue. And number two, it won't feel very good. So I wouldn't recommend that. If you were going to roll out the side of your body, you come to a seated position. I recommend just kind of leaning over and positioning the foam roller where it feels good. And then you can kind of roll back and forth if you wanted to get on the side where the rib cage is a little bit. For some, this feels good. For some, it doesn't. You could also rotate more onto the side of the back to get towards the back of the arm and shoulder. So we're not under, we're on the back. And I always support the head. And you can just roll like that. That can feel really good if you have tightness in the back of your shoulder joint. And then if you wanted to roll out your forearms, so maybe you type a lot, or you're on a computer, sitting, holding a book, holding your phone, these muscles can get tight as well. So for this one, you could come onto your hands and knees, just put your forearms on and just roll back and forth like this. And then you can rotate palms up and also roll that area out too along the forearms. I also really like to use foam rollers to assist with stretches. So if you are a runner or a biker and you have a lot of tightness or soreness after those activities, or maybe just in general you notice tightness in your body, perhaps you're noticing in some of your yoga poses that you've got tightness and you're having a really hard time kind of breaking through that barrier without pushing yourself, foam rolling could be a really good option to help break up some of that tissue tightness so you can get a better stretch. So for example, if I was going to do child's pose and I wanted to change the stretch a little bit, I could use a foam roller. I would just put my arms on it, my big toes come together and my knees come apart, and then I'm just going to stretch like that. It's a great stretch to get underneath the arms and the shoulders, not pushing anything, but just to get here into a stretch and hold. And then of course remembering to breathe. Good. And one other exercise that I really enjoy to use with a long foam roller is to place it in this position lengthwise. Sit on the foam roller and walk yourself back. Your pelvis should be supported on the foam roller and your head should be supported on the foam roller. Never let your pelvis or your head hang off the ends of the foam roller, okay? So this one would not work with a short foam roller. I would never recommend that. But if you have a long one, this is great. So you can lay on the foam roller like this, palms up towards the sky, and just have a really nice stretch, almost imagining that your shoulder blades are gonna sink around the foam roller. It's a great stretch for your pecs. It's great to unweight the spine. And it's a really good overall stretch and mobilization position for the mid-back. And you just hold here for a few nice deep breaths, maybe a couple minutes. And then when you're ready to get off of the foam roller, I recommend just kind of rolling to your side and off, just like that. As far as the length of time that you would perform the foam rolling, it really depends on your comfort level. We do want to spend enough time on the tissues to make a lasting change. So a minimum of 30 seconds in an area. You could do up to 2 minutes in the calf muscles, the hamstrings. It doesn't have to take a long time, but you do want to do really slow and controlled movements so it takes a little while, because that's where we see changes in the muscles and the fascia.